Hi, everyone. My name is Dr. Patrick McGrath. I'm the Chief Clinical Officer for NOCD. If you're looking for help for OCD or related conditions, check us out at NOCD.com. That's NOCD.com. Today, I'm going to talk to you about what ERP stands for. It is Exposure and Response Prevention Therapy, and it's a form of treatment that is utilized for obsessive compulsive disorder. We also use forms of it for other anxiety disorders as well. Exposures are literally the parts of the therapy where we want you to be exposed to the things that are uncomfortable. So for obsessive compulsive disorder, that's the obsessions. Whatever those thoughts, those images, or those urges might be that you have that you may find to be intrusive, unwanted, or inappropriate. Now, that's not enough. If we could just expose people to things and then they would be cured by that, that would be a much easier form of treatment. But unfortunately, the treatment isn't always so simple. The requirement is actually something that we call response prevention, or that's the RP part of the treatment. And in response prevention, what we do is we purposely have people live with the discomfort that OCD brings instead of doing the typical compulsions. So to think of it more literally, response prevention is actually preventing the typical response. And in OCD, that typical response is, well, the compulsion. And so if we can teach people to do an opposite response, something different than whatever the compulsion is, it offers the person with OCD a chance to actually have a change in their life. If doing compulsions were actually helpful, people with OCD would not need treatment because they would do enough compulsions, everything would be fine, and then they would move on with their life. It turns out it's the compulsions that actually keep people stuck with obsessive compulsive disorder, and why that has to be the target of treatment. So we will purposely expose people to things that are uncomfortable, and we will have them not do the usual replies, the typical compulsions or the rituals, sometimes it's also called, that they do in order to learn that they can handle living with whatever the obsession is without having to neutralize it or try to make it go away. At NOCD, we specialize in the use of exposure and response prevention, or ERP, for obsessive compulsive disorder. If you're looking for help for OCD treatment and you want to be with an expertly trained therapist who knows how to utilize exposure and response prevention, check us out at NOCD.com. That's NOCD.com. Thanks.